So for my poster presentation, I chose to do post-traumatic stress disorder. And what is a post-traumatic stress disorder? It's also called PTSD, and it's a psychiatric disorder that can occur in people who have witnessed a traumatic event, either physically or mentally. And people at times call it the hidden wound because sometimes a lot of people expect to see something physical, but it's really more of like a disease that causes a lot of harm mentally. And again, like it can cause as much harm as a physical accident or even more. And so, how does it work? So, these traumatic events have the possibility of triggering the brain's alarm, known as flight or flight or fight or flight, that we've learned in other classes. And this arises when we have feelings of danger or threat or panic. And once this alarm rings, the hypothalamic, pituitary, and adrenal systems, known as the HPA axis, work together to send signals to the sympathetic nervous system, which is responsible for the communication between the adrenal glands and the internal organs. These help regulate functions that we know, like heart rate, like things that are involuntary that we don't control by thinking about it. And this starts a chemical spark, and it fills the body with several different stress hormones. So these stress hormones are responsible, like for defending, I guess, the body and preparing the body to like bring out hormones that can defend the body. So these hormones cause elevated levels of stress, and they can last for days and contribute to nightmares, jittery feelings, insecurity, and just a lot of other symptoms until the hormones stabilize. And so here are some of the symptoms of PTSD. The symptoms fall into four categories. The first category is intrusive thoughts such as dreams or very intense flashbacks that almost make you like remember the whole event as if you were there again, involuntary memories. And then the second category is negative thoughts or feelings such as like fear, anger, guilt, reactive symptoms such as like that of irritation or recklessness, or avoidance, which is like avoiding people, places, objects, or like just anything that may trigger the memory of the incident. And so not everyone has the same symptoms or last the same time, but if any of these symptoms are present over and over again, PTSD can be often diagnosed. And something that a lot of people don't know is that genetics and other factors can play a role in seeing who will experience PTSD, but it honestly, the cause for it is still a medical mystery. It's just a trauma-based incident. So some of the statistics or quick facts about PTSD is that about 8 million people have PTSD in a given year, and this is in the United States. And 1 in 13 people will develop PTSD at some point in their life. An estimated 5% of adolescents experience PTSD, and a lot of people don't know that someone with PTSD can experience depression, suicidal thoughts, anxiety, or substance abuse disorders because of PTSD. Like all of the or not, like these can all be triggered together. Um, so some facts. So the diagnosis for PTSD, for some events, people may be able to have symptoms after for a couple of days, but they may not last. And so for PTSD to be diagnosed as a condition, these symptoms that we previously talked about have to last up to a month and persist. Like, and these symptoms can happen either right after an event and last, or like 3 months after. But if the symptoms are causing problems and distress to a patient where they're inhibited from actually living their life, and it's causing them like further um, like problems, then it is diagnosed and treatment options are available to the patient and followed with. So some of the treatments that are present are psychotherapy, which kind of helps the patient understand what their personal triggers are. Group therapy, which, encourages survivors of similar traumatic events to share their experiences in like a setting where everyone is responsive and like is comfortable with each other and not judged. And so something that um has to do, like, a lot of people use group therapy for is like veterans, where they like to talk, I guess, about their traumatic events. And then medication is overall the number one, I guess, treatment for PTSD, because it can provide symptom relief, um even though, and it allows people to if like participate more effectively in other therapies and just be able to get their life back. But there's also therapies which some people would say are better than medication. And cognitive processing therapy, it focuses on modifying painful negative emotions and belief due to the trauma. So it like helps you move from the blame that you feel for the trauma, such as like a victim feeling the blame for being raped. And the another sort of therapy is prolonged exposure therapy, which it uses repeated detailed imaging of the trauma or progressive exposures to symptom triggers in a safe, controlled way to help a person face and gain control of fear and distress and learn to cope. So, an example is like virtual reality programs. So, this way, people are able to like confront their symptoms and confront their experience of PTSD in a controlled state, so that they know why these symptoms are coming and how to cope with them. So a lot of people ask, like, what can I do if my loved one or if my friend or anything has PTSD? And the most important thing is to give as much support as possible. And you can either help them manage their symptoms, track their symptoms, help them alleviate like the pressures of daily tasks, such as like laundry or cleaning the house, or, and like most importantly, just being there for them emotionally and listening without judgment. That's really important, because a lot of people like to input their opinion or input their stories, and it's important to just listen to them without like putting in your opinion or um trying to put the attention onto you, and just letting them know that they are loved and that they can take as much time as they need to heal. Like, there's no time limit on healing. And some resources are the Veterans Family United, SAMHSA's National Helpline, National Center for PTSD Home, and a lot of other resources that you can call. And here are my references. Thank you.